Hi, everyone. I'm your host, Dr. Terry Haddad, Vice President of Community Initiatives at Community Services for Children. Welcome to the Parent Project Podcast. This work stems from our vision for an engaged community where every child thrives and every family succeeds. CSC has been serving families for over 50 years, and we know that parenting can be hard. We're inviting local doctors, teachers, counselors, social workers, and other experts to provide perspectives to help parents maneuver the sometimes challenging role of parenting. I am so delighted to welcome Dr. Brown to speak with us today. She has been an integral part of the Children's Clinic at LVHN, now at Valley Health Partners Children's Clinic for over 25 years. She's one of our favorite pediatricians here at Community Services for Children. She serves in a dual role as Medical Director of Population Health for Lehigh Valley Riley Children's Hospital, and she's a pediatrician with Valley Health Partners. So, Dr. Brown, we're so happy to be with you today. Welcome.
Thank you very much. It is my pleasure to join you, and I would like to thank our listeners for joining us as well.
Yes. So today, Dr. Brown's going to talk to us about promoting healthy brain development in young children. So what's the best way to do that, Dr. Brown?
So when we talk about promoting healthy brain development, we need to recognize that process starts before birth, actually, but certainly at the time of birth of your baby. And the way that we promote healthy development is through social connection to our infants and toddlers and offering opportunities for shared attention to activities.
So tell us about social connection and shared attention. How about giving us some examples of those?
Sure. So social connection begins from birth. It's looking your newborn baby in the eye, making that eye contact, touching your baby, soothing your baby, looking for that response. That starts right away. When I see a 2 or 4 month old infant in the office, my favorite thing to do is to have them lie on the exam table and I look them in the eye and talk with them and ooh and ah with them. And sure enough, it'll be this response of the eyes brighten up, the arms and legs start moving with some excitement, the mouth starts moving, and the next thing you know, an ooh or an ah comes out. And we have a back and forth conversation that way, often really surprising parents at the extent to which infants of that very young age can actually have a conversation with you.
Oh, it is. There's nothing like a baby in my mind, I got to tell you.
It's
nothing
wonderful.
Like a baby, right? So what does shared attention mean? I'm not sure I'm familiar with that term.
So shared attention means that you have a moment already where you're socially connected with your infant or toddler, and now you're going to both share your attention to an object or an activity. So my favorite example of that, of course, is with a book. And this can start very early as well. We start giving out books at 6 months of age. We give that a book at every well visit through 5 years of age, promoting this concept of shared attention to a book. So you're looking at the pictures, the infant is having this visual stimulation of these colorful pictures. You're drawing your attention to the pictures, maybe talking about it a little bit, allowing an infant to hold the book. You know, an older infant can sit up with the book, prop up with it, turn the page. And of course, a toddler and then even beyond as a preschooler, they're very excited about pointing to things, starting to name things in the book, saying names and exchanging, where's the dog? Where's the cat? What's this? What's that? That sort of back and forth interaction, that shared attention. And that is a very powerful stimulant for brain development.
Oh, that is That is wonderful. It makes me so happy that you're always promoting books and reading and literacy, just like we are here at CSC. What kinds of things should parents avoid? What's not great for brain development?
So we often hear questions from parents about what's the right amount of screen time, or, are certain tablet programs helpful? And we want to advise caution around screen time. And by that, I mean, the iPhone or a tablet's regular television, computer screens. And the concept I want to get across is that much of screen time is like a parade to very young children. It's lights and sounds and color, and so it's sort of mesmerizing or entertaining. But what we lack is shared attention and a real exchange of connection or ideas. So a child can learn to push buttons to make something happen on a screen, but that's not really engaging them in a way that's as helpful to development as what we talked about with a book. So if you sit with your child and you're doing a game together on a screen and engaging in that, that's okay for short periods of time, but we advise limiting that. So for infants and toddlers, under the age of 18 months, really screen time isn't recommended or very limited. Of course, there's going to be times where you need to do a phone call or make dinner, or you're out in public and you need a brief, distraction. But for the most part, really focusing on the kinds of interactions that we've talked about. And then in the child that's 18 months to 5 years, limiting that to about an hour a day. And again, trying to interact with them when they're engaged in some screen time.
Understood. Great advice from Dr. Brown. What other resources can help with brain development?
Engaging your child in other social connections and activities, especially with other children, is very helpful. So that might be at a child care center, especially if you're working. Your child could be enrolled at a center and having these excellent sorts of interactions. It may be a neighborhood or a family play group. It could be your community library, a playground when the weather's nice, or a preschool program. Any of these opportunities to interact with other adults, other children, and again, in this mode of being socially connected, communicating, working things out sometimes with other children, negotiating different wants, and also shared attention in activities, whether it's reading or taking turns on the playground, playing hide and seek. Those sorts of activities are wonderful.
Oh, you've given our listeners some great tips. Are there any other takeaways that you want to share?
I think the most important point is the best way to promote development in your young children is just to spend time with them, to be engaged with them, again, around work schedules and family needs of meals and whatnot, but reserving some time each day to be really connected and engaged in activities together. And again, that can be anything from reading books to an art project, a puzzle, a game, playing in the house together, going for a walk, going to a playground together. All of those are wonderful ways to interact with your children and promote their development.
Wonderful. Yeah, and talking to your child does so much for vocabulary and thinking. Great to have you with us as always. And Dr. Brown's at the Children's Clinic, so we know where to find you. Thanks for being here, Dr. Brown.
Thank you very much.
Thank you so much for joining us, and thank you for listening. To learn more about the Parenting Project podcast, Project Child, or Community Services for Children, please visit cscinc.org. community.org.